If you take a small pill every morning for your blood pressure and you still feel exhausted most of the day, if you have noticed extra weight around your middle, if climbing a single flight of stairs leaves you out of breath, there is a very real chance your doctor has you on a medication called a beta blocker. And the latest research is showing us something that most doctors have not fully caught up to yet. For many people over 60, that pill might actually be working against you. Before we go any further, I want to be very clear about something. This video is for education only. I am sharing what the current science says, so you can have a smarter, safer conversation with your own doctor. You should never stop or change any prescription on your own. But by the end of this video, you will know exactly what to look for, what to ask, and what steps to take next. My name is Dr. Your Name, and this channel is built for one purpose: to give you clear, honest, science-backed health information made simple for adults over 60. No hype, no confusing words, just real answers that help you feel like yourself again. If you are tired of guessing what your medications are actually doing to your body, stay with me. What I share in the next few minutes could change the way you manage your blood pressure forever. Let's start with the basics. You have probably heard these names before: metoprolol, atenolol, carvedilol, propranolol. You might know them by their brand names like Toprol or Tenormin. They are called beta blockers. For over 50 years, they have been one of the most common pills prescribed for high blood pressure. They are cheap. They are familiar. Doctors have used them for a very long time. And for a long time, they were considered the first choice. But medicine does not stand still. Research moves forward. And what we know today is very different from what we believed 20 years ago. So how do beta blockers actually work? Think of your heart like a door with locks on it. Your body makes a natural chemical called adrenaline. When you feel stress, or you stand up quickly, or you start to walk, adrenaline is the key that unlocks those doors. It tells your heart to beat a little faster and a little stronger. That is normal. That is how your body gives you the energy you need. Beta blockers work by sitting inside those locks. They block the key. Adrenaline cannot connect. Your heart slows down. Each beat is softer. Your blood pressure comes down. On paper, that sounds like a perfect plan. And for certain heart conditions, beta blockers are still life-saving. If you have had a heart attack, if you have heart failure, if you have a dangerous heart rhythm like atrial fibrillation, in those cases, slowing the heart protects it. They are absolutely the right tool. But if your only diagnosis is high blood pressure, if your heart is otherwise healthy, the picture has changed completely. Let me tell you why. A few years ago, a massive study called the ASCOT trial looked at over 19,000 people with high blood pressure. It was so large, so well run, that the researchers had to stop it early. The results were too clear to ignore. The group taking beta blockers had more strokes, more heart attacks, more new cases of type 2 diabetes. The group taking newer blood pressure medications had 23% fewer major heart and stroke events. 23%. That is not a small number. That is a huge difference. Because of that study, and many others that followed, the United Kingdom officially removed beta blockers as a first-choice pill for simple high blood pressure. Other countries updated their rules too. Yet, in the United States, millions of adults over 60 are still taking them. Not because they are dangerous in an emergency way, but because they were prescribed years ago. The prescription was never reviewed, the guidelines changed, the pill bottle stayed the same, and your body has been carrying the side effects quietly day after day. If you are taking this pill and you feel tired, heavy, or stuck, you are not imagining it. You are not just getting older. You are not weak. Your medication may be holding you back. Let's walk through the 3 most common ways this happens, and more importantly, what you can do about it. The first problem is fatigue and exercise intolerance. This one is bigger than most doctors talk about. When you block adrenaline in your heart, you put a hard ceiling on how fast your heart can beat. For a younger person sitting at a desk all day, that ceiling might not matter. But if you are 65 or older and you want to take a walk, swim, garden, or play with grandchildren, that ceiling becomes a wall. You start to move. Your legs feel heavy. Your breath runs out fast. You hit a wall much sooner than you used to, so you stop moving. Here is the hard truth. Movement is one of the most powerful, natural ways to lower blood pressure. But when your medication makes moving harder, you move less. And when you move less, your blood pressure stays high. It becomes a quiet loop that drains your energy and your confidence. I met a gentleman named Harold. He was 71. He used to walk the neighborhood every evening. Then he stopped. He told me he felt like he was running on half a tank of gas every single day. He was on atenolol for 3 years. In that time, he gained 14 pounds. His blood sugar crept into the pre-diabetic range. He just wanted his old life back. When we looked at his medications and the current science, everything suddenly made sense. The second problem is metabolic change. This one is well documented, but rarely explained simply. Beta blockers make your body less sensitive to insulin. That means your blood sugar has a harder time staying balanced. They can raise your triglycerides. They can lower your good cholesterol, which we call HDL. A large review of studies published in the Journal of the American College of Cardiology found that people on beta blockers had a 22% higher risk of developing type 2 diabetes compared to people on other blood pressure pills. If you are already watching your blood sugar, or if your doctor told you you are in the pre-diabetic range, adding a medication that pushes your body toward higher blood sugar is a real concern, especially when there are safer options available. You might say, but my blood pressure numbers look fine on the cuff. Yes, they might, but a normal reading does not always mean normal health. You can have good numbers on paper while your energy fades, your waistline grows, and your metabolism slows. The pill fixes the number, but it may quietly strain the system underneath. The third problem is fall risk. This one is deeply underdiscussed in older adults. Beta blockers can cause what doctors call orthostatic hypotension. That is a fancy term for a sudden drop in blood pressure when you stand up. You know that quick dizzy feeling when you rise from a chair or get out of bed? In your 30s, you shake it off. In your 70s, it is not just uncomfortable. It is a fracture waiting to happen. Hip fractures in adults over 70 carry a serious risk. Recovery is long. Independence can be lost. And the fear of falling often leads to less activity, which leads to weaker muscles, which leads to higher fall risk. It is a cycle we must break. Now, before I share what the current evidence supports as better options, I need to say something very important. This part could protect your health. Do not stop this medication on your own. Do not skip doses. Do not throw the bottle in the trash. Stopping a beta blocker cold turkey can cause a dangerous rebound. Your heart rate can spike. Your blood pressure can jump quickly. In some cases, it can trigger a heart attack or a dangerous rhythm. Any change must be done slowly, under a doctor's supervision, usually over 4 to 8 weeks. Your body needs time to adjust. What I am giving you today is not permission to change anything on your own. It is information. It is a roadmap. It is a set of clear questions to take to your doctor so you can work together safely. So if beta blockers are not the best first choice for simple high blood pressure, what is? 2 medication groups stand out clearly in today's research. The first is calcium channel blockers. The most common one is amlodipine. The ASCOT study showed this group had far better outcomes. It does not block your heart's natural response to movement. It does not carry the same risk for blood sugar changes. And a large study in the British Medical Journal confirmed it was linked to fewer strokes than older beta blockers in adults over 60. The second group is ACE inhibitors and their close cousins, ARBs. You might know these as lisinopril, ramipril, losartan, or olmesartan. They work differently. They relax blood vessels. They protect the kidneys. They often help people with diabetes or early kidney changes. And they carry a much lower risk of dizziness and falls. One quick note, ACE inhibitors like lisinopril can cause a dry, tickly cough in about 10 to 15% of people. If that happens to you, do not just stop the pill. Tell your doctor. Switching to an ARB like losartan usually solves the cough while giving you the same benefits. I want to share another story with you. Dorothy was 74. She had been on a beta blocker for years. Her cardiologist reviewed her file and slowly transitioned her over 8 weeks to amlodipine combined with losartan. Within 3 months, her fasting blood sugar returned to normal. She lost 7 pounds without changing her diet. She told me she felt like herself again. Her blood pressure readings were steady. Her energy came back. She could walk the grocery store without stopping to rest. Her body finally had room to breathe. Now, I want to be very clear again. Beta blockers are still the right medicine for many people. If you have coronary artery disease, if you have had a heart attack, if you have heart failure, If you have certain heart rhythm problems like atrial fibrillation, the math changes. The benefits are strong, the evidence is clear. But if your only diagnosis is high blood pressure, if your heart is otherwise healthy, it is completely reasonable to ask, is this still the best pill for me today? So what should you actually do with this information? Here is your step-by-step plan. Step 1. Look at your pill bottle today. Find the generic name. Is it metoprolol, atenolol, carvedilol, bisoprolol, or propranolol? Is it listed specifically for blood pressure? Not for a past heart issue, not for palpitations, for blood pressure. Write it down. Step 2. Before your next appointment, write down 3 clear questions. You do not need to argue. You just need to ask. Say this: Doctor, was my beta blocker prescribed specifically for high blood pressure? Does that still match today's guidelines for someone my age? Second question: have we checked my fasting insulin and triglyceride levels lately? Third question: based on my full health picture, would I be a good candidate to try a calcium channel blocker or an ARB instead? Step 3. Ask for a formal medication review. If you have been on the same pill for more than 2 or 3 years without a check-in, you have every right to ask for one. Medicine changes fast. What was standard in 2005 is not always standard today. A good doctor will welcome this conversation. Step 4. If you and your doctor agree to a change, ask for a clear tapering schedule. How much will the dose drop each week? How many weeks will it take? What symptoms should you watch for? A responsible doctor will guide you slowly and safely. Step 5. Start tracking today. Keep a simple notebook. Each morning, write down your blood pressure. Rate your energy on a scale of 1 to 10. If you check your fasting blood sugar, write that too. Do this for 3 to 4 weeks. When you bring real data to your appointment, the conversation becomes focused, fast, and productive. I know some of you are thinking, but I worry about the cost of newer pills. That is a fair concern. Let me give you a quick reality check. Most of the newer first-choice blood pressure medications are available as low-cost generics. Amlodipine, lisinopril, and losartan are often available for $4 to $10 a month with standard pharmacy discount cards or Medicare Part D plans. If your current brand name pill is costing more, ask your pharmacist about switching to the generic version. If you hit a coverage wall, ask about a tier exception or a manufacturer patient assistance program. Do not let cost silence your health. One more critical point. Many adults over 60 take 5 or more medications, including over-the-counter pills and supplements. This is called polypharmacy. It matters here. Common pain relievers like ibuprofen or naproxen can raise blood pressure and weaken the effect of your blood pressure medication. Certain supplements can interact too. Always bring your full list to every appointment and ask your pharmacist for a free medication review. Pharmacists are medication experts. They can spot interactions in minutes. Speaking of your home blood pressure monitor, let me show you how to use it correctly. Many people get wrong readings because of simple mistakes. Sit quietly for 5 minutes first. Keep your feet flat on the floor. Rest your arm on a table so it is level with your heart. Do not talk while the machine runs. Take 2 readings 1 minute apart. Write down both, then use the average. Do this in the morning before your pill and in the evening before dinner. This simple routine gives your doctor a true picture, not a snapshot. Now, pills are only one piece of the puzzle. Your daily habits work alongside them. Here are 3 simple proven steps that support healthy blood pressure without overwhelming your day. Number 1, simplify your plate. You do not need a strict diet overnight. Just add 1 vegetable to every meal, fresh, frozen, or canned in water. Pair it with lean protein like fish, chicken, or beans. Cut back on highly processed foods with hidden salt. Small, steady shifts move your numbers over time. Number 2, move safely for 10 minutes a day. If walking is hard right now, sit tall in a sturdy chair. Lift 1 knee at a time. Stand up and sit down slowly 5 times. March in place while holding the counter. Movement does not have to be hard to work. It just has to be consistent. Your heart learns. Your muscles wake up. Your energy returns. Number 3, try the 4-7-8 breathing method. Breathe in quietly through your nose for 4 seconds. Hold for 7. Exhale slowly through your mouth for 8. Do this 4 times. This simple pattern tells your nervous system to calm down. It lowers stress hormones. It supports steady blood pressure. You can do it in your car, in your kitchen, or in bed. I want to set clear expectations for you. If you and your doctor agree to switch medications, changes do not happen overnight. Your energy usually starts shifting in 2 to 4 weeks. Blood sugar and cholesterol markers often improve in 6 to 8 weeks. Weight changes take longer, usually 3 months or more, especially when paired with gentle movement and steady food choices. Track your progress. Celebrate small wins. Healing is a quiet process. There are times when you must act fast, no matter what pill you take. If you ever feel chest pressure or pain, if you break out in a cold sweat with shortness of breath, if you feel sudden confusion, weakness on one side of your body, or trouble speaking, if you faint or fall hard, call 911 right away. Do not wait. Do not drive yourself. Your safety comes first. You deserve a treatment plan built on today's science, not a prescription written a decade ago. You deserve to feel light, to move easily, to climb the stairs without bracing yourself, to wake up with energy that lasts. If this video helped you see your medication in a new way, I want you to do 3 simple things. First, leave a comment below. Tell me your current blood pressure medication, or simply type "reviewing mine" if you plan to bring this up at your next appointment. I read every single comment. Your stories help me plan future videos that serve you directly. Second, share this with someone you care about, a spouse, a sibling, a friend who always complains about being tired after meals or struggling with short walks. One conversation armed with clear information can change the next 5 years of their life. Third, subscribe to this channel. We keep our videos focused, honest, and built for adults over 60. No fluff, no fear tactics, just clear steps that help you take control of your health. And if you want the exact checklist I mentioned, I have put a free printable blood pressure medication review guide in the description. It includes the 3 doctor questions, your symptom tracker, and a simple home BP logging sheet. Print it, fill it out, bring it with you. It will make your appointment smoother and more focused. Next week, I am covering a silent mineral deficiency that makes blood pressure medication significantly less effective. Most doctors do not test for it, yet it is one of the fastest, safest ways to support your numbers from the inside out. You will want to catch that one. Until then, keep tracking, keep asking questions, and keep speaking up for your health. I am Dr. Your Name. Thank you for your time and for trusting this channel. I will see you in the next video.